Hello, everyone, and welcome to Nursing 609 Health Economics. In this course, we will study the field of economics in general and how it relates and impacts healthcare in specific. When defining the field of economics, I think Nobel Prize winning economist Alan Roth defined it the best. He stated that economics as the efficient allocation of scarce resources and about making such resources less scarce. So defining economics as it relates to healthcare, you could say that healthcare economics is the study of scarce resources and how they are allocated to and within the healthcare sector. While rooted in microeconomic theory, the field has become highly empirical in recent years. And so this is a course in applied microeconomics with insights from the fields of industrial organization, public economics, labor economics, health policy, and health law. As previously stated, the economic perspective of the healthcare sector is that we live in a world of scarcity. And all healthcare goods and services that people want cannot be immediately produced or provided. There are only so many hours in a day and so many resources after all. That's why it may take a few weeks or, depending on where you live, even a few months to meet with a specialist, and why there may be long waits in an emergency department, and why some physicians do not accept new patients with Medicaid coverage. So because of scarcity, trade-offs must be considered and choices must be made. There must be some way to ration scarce healthcare services and products. One way to do this is through the markets, whether they be highly competitive, controlled by a few firms, or monopolized by just one firm. They can assign prices to healthcare services and products. Price mechanisms may not be the only way to ration scarce healthcare resources. Indeed, resources are often allocated administratively, such as by health insurers, by governments, or even by emergency physicians. So when it comes to examining how scarce healthcare services and products are allocated in practice, we need to consider the various institutional features of the healthcare sector and the role of government in healthcare markets. We should also consider and possibly debate whether healthcare markets are fundamentally different from other markets, and if they are, why would that be? So this course will introduce you to key concepts, models, and empirical findings in the field of health economics. We will explore several issues related to health and healthcare, from the determinants of health behaviors and health outcomes to the challenges facing the U.S. healthcare system. Specifically, we will examine the markets for health insurance, hospital care, physician services, and prescription drugs, along with the labor markets for healthcare professionals. Our primary goal will be to identify practical policy recommendations for improving healthcare and health outcomes in the United States. With that in mind, Jonathan Gruber, a health economist, noted that part of the success of health economics is due to the powerful role that our profession is playing, not only in pushing forward the frontier of scientific knowledge, but also in translating the lessons of our research for the real world. Innovations in health policy, from an expanded role for Medicare managed care organizations, for instance, in the 1990s, to the Part D drug benefit of 2003, to the Affordable Care Act of 2010, all relied heavily on economics research and insights. So for this course, I really encourage you to feel free to ask any questions. You can do that either by email or you can text me. Also, if you should have any additional topics that you would like to explore, please let me know. I'm always willing to schedule a Zoom meeting if you feel a need to meet and discuss any part of this course. And as you can see, you have my email address on this slide as well as my cell phone number, which you can text me at any time, and I will try to get back to you as quickly as possible. As for the course materials, we'll be using the text entitled Health Economics, Core Concepts and Essential Tools by Steph Burnell. This text will cover the first 9 modules of the course. We will begin in Module 1, which is entitled What It Means to Think Like a Health Economist and How Economists Approach Issues in Healthcare. We will then examine the relationship between health and wealth, or health and income. Move on to how economists view the production of health and the production of health-related goods and services. Module 5 will look at the factors that influence the demand for healthcare. Module 6 will take a look at how healthcare and other markets are structured and how they affect outcomes. In Module 7, we will examine physician and provider behavior and their impact on the economics of healthcare, while Module 8 will explore the various insurance markets and how they shape the industry. And finally, Module 9, we will consider when healthcare interventions, policies, and programs are what is known as cost-effective. In addition to the text, we will be reviewing sections of the book by Uwe Reinhardt entitled Priced Out, The Economic and Ethical Cost of American Health. We'll review the first section of this book in this week's module. So for many of you, this may be the first economic course in which you have enrolled. So please keep in mind that the goal of this course is not to produce economists. It is meant to give you an appreciation of the field and the integral role it plays in shaping the strategies and decisions made by health professionals. I would also strongly suggest that you download the PDF entitled Principles of Economics, second edition, which is available on Canvas in this course. It will serve as a good reference source as we go through the curriculum.